I'm Catherine Birken. I'm a general pediatrician and researcher here at Sick Kids. My area of interest is prevention, and specifically obesity prevention in early childhood. KT is about synthesizing the available evidence, generating new evidence where it's needed, and delivering that evidence into the hands of practitioners and parents who need that evidence to improve child health. So the work that we do in knowledge translation is trying to integrate knowledge translation into primary care practice. So we started in 2008 with our colleagues and friends that had a common goal and interest of keeping children healthy as they grow. We've created a network called Target Kids. Target Kids is a practice-based research group for kids. It's a collaboration between practitioners, family doctors, and pediatricians, researchers, parents and families. We've started by asking parents and clinicians what are the most important unanswered research questions to them. So how it works is children attend their regularly scheduled well-child visits. They're greeted by our research team and then invited to participate. In a traditional paradigm, research is generated by researchers and the results make their ways back to practitioners. In our model, research is generated by practitioners in practice with quick time results back to those practitioners and parents, making research more relevant for practitioners, more timely and more meaningful to parents and their children. I think the biggest gaps for early child health are in collecting information that's relevant for our youngest children. Our national studies in Canada exclude children under 3. 1 in 4 children are at risk of overweight and obesity, putting them at risk for cardiovascular disease and diabetes later in life. 1 in 5 children are at risk of anxiety and depression and mental health problems. And 1 in 4 children in Canada are not developmentally ready to start school. There are opportunities in our healthcare system currently to address some of these important gaps. Children attend primary health care multiple times within the first years of life. This is an opportunity to gain really important information about how children grow and develop, and then intervene to improve their growth and development overall. What we're hoping to do is develop research that will aid in policy development to improve child health and to prioritize prevention in early childhood health. We see Target Kids as a living lab within the community, generating the evidence to inform practice guidelines for practitioners. We want to test interventions in primary care to improve child health, and ultimately this work will lead to changes in policy and practice for healthcare for children. I think what got us here is really building relationships. It's building relationships with other researchers that have common goals and passion around prevention. It's building relationships with community practitioners that have a really good understanding of what the problems are for parents and children, and building relationships with families that have a trusting relationship with their practitioner.